standing by and breathlessly waiting. Well, I assume breathlessly anyway. How's the asthma holding out there, Charles?
It's pretty debilitating,
Pretty debilitating. Charles Katebi
Yeah.
standing by, who is going to try to convince us that some people in government are actually going to cut something out of the budget. And frankly, Charles, I don't believe it. What do you got?
Well, you should never believe that unless there's just no money left. And that's what the situation is,
Right.
more or less. So the CREG, the Consensus Revenue Estimating Group, this is the state projecting group that the state uses to project our revenue. They found that we're actually going to be $130 million short over the next biennium,
Wow.
even less than what we thought in last January when they were saying there would be a $700 million shortfall.
Let me stop you right there for just a moment. I always take worst-case scenarios. So are they trying to, when you're dealing with something like this, you don't know how bad it's going to be, so you assume the worst, and then you double down on the worst, and that's probably what you should go with. Is that what they're doing? Or are they taking the best worst-case scenario?
They've always been very conservative with their estimates. They don't want to frighten those politicians, bless their hearts. So in January they said that there would be around a $700 million shortfall over the next biennium and the remaining months of 2016. That's what they said. And then they came out with another report just last April and said that the shortfall for this upcoming biennium will be $110 to $130 million more. That's how much less revenue we're going to be getting in.
Right.
So after that, Governor Meade said that every agency needs to cut their budgets by 8%. And to deal with this. So the universities is taking a hit, education is taking a hit, and in particular, healthcare is going to be taking a big hit. So at the recent committee hearing in Casper, the Department of Health said that they need to find about $117 to $200 million worth of cuts in their $2 billion budget to go along with the governor's orders. Now, most of that is going to hit Medicaid because they make up about 70% of all the health care spending that the state does. Right. And that's going to hit a lot of people very hard.
Mm-hmm. And didn't the governor turn and lament that, we should have expanded it and taken the federal money?
See, I did not understand at all the case that he was making. First, he said that we need to tighten our belts because we have less money coming in.
Right.
Because of the fall in mineral revenue, and then he said, "Well, hey, if we had expanded Medicaid, maybe those fired miners could have gotten health care." But I'm a little confused because I don't know where we would have found that money because we have to cut spending now.
Well, and doesn't he understand? It must have been explained to him multiple times. You go ahead and expand this, and there's going to be people coming in from other states to take advantage of it, like has happened with all the other states that have expanded it.
Yeah, that's absolutely right. No, he didn't even touch on that, and I think that was even lost on all of the Medicaid expansion proponents.
Yeah,
all of them, none of them understood the irony that if we had expanded Medicaid in February, like the governor and the hospital association wanted, we would have had to cut the promise to those new Medicaid patients. So as they were clamoring that we need to cover these people and give them their health care, the money just wouldn't be there to provide it. So it's a completely false promise if we had actually expanded it.
But by the way, isn't this the same governor? If I'm still living in the same state, I get confused now and then because I feel like I'm living in some altered state at some point, Charles. I really do. Isn't this the same governor that just recently gave his staff a bunch of raises and then hired some people?
Glenn, you don't understand.
Yeah.
If he doesn't pay them exorbitant sums, then they may go to some other state and help bankrupt them. So this is a world of trade-offs.
Did it never occur to him to turn and say anybody who wants to make that much money should go to another state?
Well, they're more than willing to, but I mean the problem with Wyoming is that it's a very rural state, and a lot of times we need to pay people to come here. That's why teachers are paid a bit more in Wyoming than other states, and that might be why we pay doctors a bit more in this state as well.
But and not to get too far off the subject here,
sure.
but do you see how that constantly snowballs. Because if we raise all of the governor's employees, direct employees, give them a nice big raise to pay them just a little bit more than the other states, then the other states should get worried that, oh my Lord, these people that work for us might move to Wyoming. So they give raises. Well, in order to remain competitive, then we have to give raises. And it just goes on and on and on. It's like an employee's market at this point, isn't it?
It's a very vicious cycle. And one more thing we should also remember is that it's not the job of the average Wyoming citizen to actually pay these exorbitant salaries more than the average to attract these bureaucrats. We really don't need them. And if we wanted Wyoming to be more attractive, we should just make it more attractive for businesses and people to buy homes here. We don't need to just keep throwing money at some government workers who may or may not come here.
Let's get back on topic now, because since I'm the guy who dragged us off topic. So, okay, these are cuts that have been suggested. I mean, real, actual cuts. Is that correct?
These are cuts that per the governor's recommendation that we have a lot less money coming in, and he said he wants every agency to cut it. Now the agencies don't have to listen to him. They don't have to put this in their requested budgets. They don't have to do that, and the legislature could veto those cuts, but the legislature does not want to wind down our huge savings, our bag of savings we've accumulated over the years. So they're looking for cuts right now. And so the cuts will primarily come onto Medicaid because Medicaid does 70% of them. And what a lot of legislators at the committee were wondering is where would we make these cuts? Because although we pay for half of Medicaid, we have very little control over how the money is allocated.
Right.
So we can't control the eligibility. We can't say no one after, say, March 1st can sign up. You can't do that. It's an entitlement program. You have to do that. And you have to cover a bunch of services as well. So what's going to happen, and this is what the director of the Department of Health said, we're going to have to cut reimbursements, which is the payments we provide to doctors to actually see these patients. And what we see in other states is that when you cut these payments, doctors have less of an incentive to see them, and which is why you see in all the healthcare literature, patients on Medicaid have terrible healthcare outcomes because it's so hard to see a doctor. And so my fear, and I think a lot of people are going to see this once they announce these cuts, is that a lot of doctors will be a lot less willing to see them, and this will be very bad for those patients.
Well, now, on the other hand, I know some doctors personally that frankly don't want to see these patients just because of the mess having to get through Medicaid like this. It's such a mess with such a low reimbursement rate. They would rather not have to see these patients at all, and some have just refused to.
That's true. It's a very burdensome administrative process to actually get paid. It doesn't fully pay the cost of the care, but that being said, Wyoming's Medicaid program does pay more than I think just about any other state. Maybe Alaska pays more. So when these cuts start coming in, we're definitely going to see a lot less people willing to pay for it. And I think now would probably be a good time to see what are some changes we would like to see in our Medicaid program. Because, I mean, I don't know about you, but I don't want to see patients that we've promised health care to not getting at least some form of health care. I mean, if we're going to be spending hundreds of millions of dollars on this program, we should at least be getting a good bang for our buck. So I think this is a good time to think about it.
Well, and of course, I think you know where I stand on that. I'd rather not be spending on these programs. And in fact, the people who would like to get onto this program, if they would like to go to another state to do it, I'm all for that. I would like to get Wyoming off of the government payroll on things like this.
Oh, I would love to as well. Ideally, absolutely. But I think we're going to be stuck with Medicaid for quite a while. I think we need to have a discussion on how can we make it more affordable for taxpayers, and how can we make it more accessible for patients as well.
Interesting. So, okay, do you see? And I know I'm asking you to look into a crystal ball. Any real cuts coming our way anytime soon? Or are we going to have to wait for the next legislative session for this to happen? Because I have a local newspaper here in my hand, Charles, headline from yesterday: county jobless claims up 200%.
Wow.
Yeah.
Was this Natrona?
Campbell.
Wow, that's a lot.
Yeah.
Well, in the case of the Department of Health, they're going to be announcing where they're going to be making these cuts in terms of what department, what programs. I think by July 1st, that's what they said. And a lot of other agencies have already announced their cuts. For the university, they announced about $35 million in cuts already. So already seeing the impact of where these spending reductions are going to be happening.
Okay. Charles, you're writing extensively and keeping people up to speed and up to date on this. Where can people find your work?
They can go to wiliberty.org.
Okay. Thank you for coming on. I do appreciate it.
Thank you.